And now I would like to start the webinar with our first topic, which is medical care. Our first presenter is Mr. Paul Schroeder. He is an interim chair of World Rescue Organization, and he is the head of Luxembourg Rescue Service since October 2015. As the Director General of the Luxembourg Fire and Rescue Corps, he leads 730 full-time and 4,000 volunteer staff in the delivery of rescue and emergency services for the Grand Duchy of Luxembourg. He holds a master's degree in public international law, a master in crisis management, and he is trained mediator. Mr. Schroeder, the floor is yours.
Thank you very much for this nice introduction. First of all, I want to stress that even though the topic is medical care, that I will expand the topic to pre-hospital care and also technical rescue, because I think that these are both combined and go together. First, a small introduction of the World Rescue Organization, which is an organization that a registered charity that has been created in 1999 and is now represented almost all over the world. We are expanding for the moment in the Asian area and also in the Latin American area, which is very important for us because of the high number of accidents in these areas. So our aim is to improve pre-hospital care and also technical rescue in cases of road crashes. What I want to say is that I will not go over the 5 pillars. I think the people in the audience know the 5 pillars, but in the 5th pillar, which is the post-crash response pillar, sometimes the part of the rescue is a little bit forgotten. But we are convinced that the road rescue is one important part in helping to reduce the deaths and the injured people that suffered from car accidents, and therefore we intervene in this area to improve the work of the rescue services in order to save lives. So our motive is to say that the challenge to prevent road deaths and injury does not end with a collision. What is needed if you want to have effective post-crash response? The first part is before the rescue services arrive on scene, of course. It's the help provided by the bystanders or the witnesses of the crash by providing first aid, of course, but also by securing the incident of the scene. And of course also to swiftly call the rescue services, of course in Europe, by using the European emergency number 112. So that is the first step, where we can save time if people are trained in first aid and also trained how to make an efficient emergency call. The second step is the treatment of the emergency call. So what is important is that that we have call centers with trained personnel who are able to identify the issue so that they are able to send on the scene the needed means to effectively intervene on scene. And therefore, I want to remind the questions that normally the operator will ask to the callers. First of all, of course, people have to identify themselves to tell who they are. Then, very important, of course, to say as precisely as possible where where they are, where the accident happened. So this is one of the first questions that is asked, so that the operator can already start to identify the competent rescue service to intervene. Then, of course, what happened, so a precise description of the accident with, of course, also the information of how many people have been injured, so that the operator can send on scene the appropriate personnel. And then at least people should not hang up the phone, but they should wait if there are any other questions asked by the operator. When I am at the call center, I also want to address one point which is quite an important one in my eyes, which is the possibility of geolocalization of the accident. I said before that one of the first questions to be asked is the question of where the accident happened. Of course, as far as road traffic accidents are concerned, often people don't exactly know where they are because they don't know the area, because it's dark, or it's difficult for them to identify exactly their position. Therefore, the European implemented years ago a system in the cars, which is the so-called e-call system. I think many of you have heard about it and know what it is about, which is a system that is integrated in the cars, and in the case of an accident, the e-call system will send an automated message to the call center with a set of data of the car and of its position. The e-call system had to be implemented in Europe until the 31st of March 2018, and each new car that is sold now should be equipped with an e-call system. In practice, however, we see as rescue services that we are still confronted with a lot of problems with the e-call system, because in the European regulation there was a choice for the manufacturers to have a system that goes to the public answering call centers, the official 112 call centers, but they also had the possibility to deviate the call through a private call center that then forwards the message to the 112 call center. And many brands, they preferred this second option. You often find now in the cars two buttons, a button for if you have a technical incident with your car, so that you can have a tow company coming pick you up with your car, and you have the SOS, the 112 button for the e-call, but which also arrives at a private company. And the problem for us is that these private companies, they are not always directly connected to the 112 call centers, or they are not possible. It's not possible for them to identify the competent 112 call center, and they are also often not in a position where they can forward the data they receive from the crashed car. And this is a big problem for the rescue services. And in the regulation, it's written that the customer can choose at the moment when he or she is buying the car, if the customer prefers the call to be deviated to the 112 or to a private company. But most car manufacturers, they don't inform people about this option. And the result is that in practice, we don't receive that much e-calls in our 112 call center, because the data do not arrive on scene. For me, it was this platform an important message I wanted to pass, because I think it's important that all stakeholders that are working in the field of road safety should be aware of this, and also maybe raise this issue at moments where appropriate moments on the European level. I come back to the stages of the road rescue. So after the call, of course, the teams are sent on scene, and what is important there? One point is the equipment. This might be a point that might not be that obvious, but it's important to stress with the new car technologies that have been developed over the last years, cars becoming safer and safer, which is actually a good thing, of course. On the other hand, also makes it more difficult for the rescue services to penetrate into the crashed cars. So it's very important that the rescue services are equipped with state-of-the-art tools, which are able to handle with these new car technologies. On the other hand, of course, and that's the most important, is the training of the teams that intervene on scene. The best equipment will not be useful if the personnel who is using it is not used to use that equipment. So the training must be up to date also there with the new car technologies, with new forms of energies that appears with electric cars, hybrid cars. The road rescue becomes a very technical and a very specialized field in rescue. And then, of course, I want to come to the main objective of a road rescue intervention is, of course, helping and saving and rescuing the victims that are entrapped or injured during this accident. And as a World Rescue Organization, we stress very much a victim-centered approach of rescuing. Often you can see when you have rescue teams on scene, you have the fire and rescue services and you have the medical services, the emergency health services, and they are not always used to work together. Often you can see first the fire or the rescue teams cutting the cars, while the medical team is standing back until there is an access to the car before they start to intervene. In the victim-centered approach, the mean is that all the involved people within the rescue team, are they the team leader, the technical operators of the tools, but also the medical personnel, that they work hand in hand and that they work parallel, so that first of all the rescue service will make an first access to the victim, so that the medical personnel can approach the victim, make a medical assessment, make first life-saving measures, and then going on with the rescue until the victim is entrapped. This is a very important subject for us, and therefore the World Rescue Organization organizes once a year the World Rescue Challenge, and our national organizations, they organize national challenges where the aim is to train teams to work together in a realistic situation, so that they are prepared for what they find on scenes in real life. So for us, this multi-agency collaboration is a very essential point. With communication is also another important point, communication within the team, but also communication towards the victim, so that the victim, because it's a very stressful situation for the victim, lot of noise, lot of strange noises people are not used to hear, and machines running. So it's very important that the medical personnel which is in contact with the victim also has a good communication with the victim, so that the victim feels safe and knows what is going on. Then, of course, the patient will be taken into hospital, and that's in this case the last point is of course then the bringing the person, the victim, to the hospital, that the information from the accident, they are transmitted to the team in the hospital, so that they have a good understanding of what happened, because the kinetic of the accident also gives important information to the doctors who have to intervene afterwards in the hospital. And then last point is that, of course, to improve your work, that at the end of an accident, of a road crash, is that you undertake an incident review, so that you can learn from maybe from mistakes you have made during the rescue operation, so that you can improve yourself, your work. So that is in short words. I don't want to go too into detail. Of course, we can discuss that in the question and answering later on, but I will stop there, and thank you for your attention.
Thank you, Mr. Schroeder.